What is the standard FDA-approved time window for administering intravenous alteplase, TPA, to a patient with an acute ischemic stroke from symptom onset? Within 3 to 4.5 hours of the patient's last known normal time, provided no absolute contraindications exist. What is the blood pressure threshold required before administering 4-TPA to an acute ischemic stroke patient? Blood pressure must be lowered to 185/110 mmHg before TPA can be safely initiated. A patient presents with severe, unilateral, throbbing headaches with photophobia and nausea. They fail NSAIDs. What is the first-line acute abortive therapy? Triptans, e.g., sumatriptan. Contraindicated in patients with significant coronary artery disease, uncontrolled hypertension, or stroke history. A male patient presents with excruciating, unilateral periorbital pain lasting 45 minutes, accompanied by ipsilateral lacrimation and rhinorrhea. What is the first-line acute treatment? 100% high-flow oxygen via a non-rebreather mask, 12 to 15 liters per minute, for 15 minutes. This classic presentation is a cluster headache. What is the first-line medication class and specific drug of choice to stop an active episode of status epilepticus, seizure lasting 5 minutes? Intravenous benzodiazepines, specifically lorazepam, for milligrams 4. A 22-year-old female with focal seizures is planning a pregnancy. Which highly effective antiepileptic drug should be avoided due to major teratogenic risks? Valproic acid/valproate causes high rates of neural tube defects. Levetiracetam or lamotrigine are safer alternatives. What is the most effective long-term medication for managing the motor symptoms of Parkinson's disease? Levodopa/carbidopa. In younger patients less than 60, dopamine agonists like pramipexole can be used initially to delay dyskinesias. A patient presents with a bilateral postural tremor of the hands that improves significantly after drinking a glass of wine. What is the first-line medical treatment? Propranolol, beta blocker, or primidone, anticonvulsant, for essential tremor. A 28-year-old female presents with acute, unilateral vision loss and pain with eye movement. MRI reveals multiple periventricular white matter lesions. What is the diagnosis? Multiple sclerosis, MS. The initial presentation is optic neuritis. Treat acute flares with high-dose 4-methylprednisolone. A patient presents with symmetric, progressive, ascending muscle weakness and absent deep tendon reflexes 2 weeks after a diarrheal illness. What is the diagnosis and diagnostic priority? Guillain-Barré syndrome. Monitor forced vital capacity, FVC, or negative inspiratory force, NF, closely to anticipate respiratory failure. What is the preferred oral first-line agent class for managing painful diabetic peripheral neuropathy? SNRIs, duloxetine, gabapentinoids, gabapentin, pregabalin, or tricyclic antidepressants, amitriptyline. A patient presents with fluctuating ptosis, diplopia, and generalized muscle fatigue that worsens at the end of the day. What antibody test confirms the diagnosis? Acetylcholine receptor, AChR, antibodies, confirming myasthenia gravis. A patient experiences brief, episodic vertigo lasting 1 minute triggered solely by turning their head in bed. What diagnostic maneuver confirms this condition? The Dix-Hall-Pike maneuver, observing for torsional/upbeating nystagmus, to diagnose benign paroxysmal positional vertigo, BPPV. What therapeutic maneuver should be performed to treat a patient diagnosed with right-sided BPPV? The Epley maneuver, canalith repositioning maneuver. A patient wakes up with an isolated, unilateral upper and lower facial paralysis, including an inability to wrinkle their forehead on the affected side. What is the treatment? Bell's palsy. Treat with a 10-day course of oral prednisone within 72 hours of onset, along with eye lubrication/patching at night.